Dermatology Associates and Surgery Center.
And welcome to today's edition of Ask the Expert. I'm Shea Paul, and I'm here in the studio with Whitney Rose, nurse practitioner at Dermatology Associates and Surgery Center. That is such a mouthful.
It is, I know, and you do so well, Shea.
Thank you, Whitney. I don't always get it right, but usually. Thanks for being with us again. Today we're going to talk about something that I shared with you has affected me and my family personally,
yes.
And that is melanoma,
Yes.
which is the deadliest form of skin cancer.
Yes.
And, you know, at different times, my family lost two very dear family friends in their late 20s to this horrible disease.
Yeah, it affects so many different people.
It really does. And today we're going to talk about the ABCs, Ds, and Es of melanoma. Can you tell us what that is exactly, what that stands for?
So the ABCDEs of melanoma is a way that us dermatology providers and patients even at home can look for certain things that can make us be concerned that possibly that it could be melanoma or something atypical that needs a biopsy to rule out melanoma.
I see. Okay. So we're going to start with the A's,
yes.
right? Okay. And the A is for asymmetry.
Yes.
Okay. So we've got a picture up here. Can you explain what you're seeing here, Whitney?
Yes. So this is a melanoma, and as you can see, most melanomas, they are asymmetrical on both sides. So that means that if you cut it in half, then one side would not be the same as the other.
Okay.
So in this picture, you can see that the one side is different than the other. In healthy moles or in healthy lesions, it'll just be the same on both sides. So that's something to look for.
Okay. And then B is for border. And so we've got a picture coming up.
Yes.
All right.
So melanoma borders, they tend to be uneven and they'll have scalloped or notched edges, while common moles tend to have smoother, more even borders. So as you can see in this picture, how uneven the borders are.
Right. Okay, moving on to C, color.
Yes, so C is for color. Multiple colors are definitely a warning sign. Benign moles are usually a single shade of brown, but melanoma, they have different shades of brown, tan, or even black. And as it grows, the colors will be red, white, and can even be blue.
Okay, all right. And then D is diameter.
So D is diameter. While it's ideal to detect in melanoma when it's small, it is a warning sign if a lesion is larger than a pencil eraser or 6 millimeters.
Okay.
So this is definitely something that we go by. However, I don't know how many times I've found melanomas that were much smaller than a pencil eraser.
Really?
So the sooner that you can get in to see us, the better.
The higher the survival rate, for sure.
Absolutely.
Okay, and then we have E for evolving, and we're going to have a before and after here. So this is a normal, I guess, something that is melanoma, but
yes.
Okay.
Yes. So this was a melanoma, and then they actually took a picture of it and then showed how much larger it had gotten.
Oh, wow.
So E is for evolving. Any change in size, shape, color, anything that is bleeding, itching, crusting, but also anything that's new, because a lot of times melanomas, 80% of them come from skin lesions that you never had, moles that just popped up.
Just pop up.
Yeah, only 20% will come from moles that you've had your whole life.
Wow, now that's interesting.
Yes.
I did not know that.
Yes,
Okay.
so evolving is very, very important.
Okay, so if any of our viewers out there, first of all, it's always important to get an annual skin check, right?
Absolutely.
Especially if you're at high risk like I am, being a redhead.
Absolutely.
So call Dermatology Associates, make an appointment for a consultation. And this is very wonderful information, Whitney, and could be life-saving.
Yes,
so thanks for being with us.
I definitely hope so. Thank you so much.